Joining us now with 5 things that nurses care about most in their jobs is our favorite nurse, Alice Benjamin, emergency room registered nurse and clinical nurse specialist. Welcome.
Good morning.
Hello.
And congratulations, or whatever we're supposed to say on Nurse Appreciation.
And by the way, I don't play cards. I just,
I bet you don't.
Right.
How do comments like that, though, affect morale when nurses hear something like that?
It's definitely a hit to the morale because nurses, we are running around, saving lives, double-checking orders, doing so many things to make sure that patients are healing, that they're safe, and maybe out of a 12-hour shift, you might catch a break, and then the 1 second that you're catching a break to be told that you're, playing cards really is disheartening. And when you have lawmakers like that who have a platform to influence other people, influencing other lawmakers, voters, the community, you might discourage someone from wanting to even enter the profession. So, really insensitive comments and disheartening. But we're not going to worry about that.
Let's get to your 5 points of care, shall we, for nurses?
Yes.
The first would be safe patient care. What are the concerns here?
This is a top priority to us. So many people may not know, but medical errors are the 3rd leading cause of death. Over 250,000 potential medical errors that lead to death. And so nurses, we play a very important role in trying our best to prevent those things. Like I said, we're double checking, triple checking orders. We're monitoring patients. We're watching you even though you don't even know that we're watching you. We're doing timeouts in the OR to make sure we're doing the right surgery on the right person, the right side. We're making sure that you understand your diagnosis, that you understand your medications and what you need to do. So we do all these things relentlessly to make sure that patients are safe.
And nurses also express concern about patients once they're discharged. What are the risks once we're discharged from a hospital?
Right. The healthcare system is very complex. So imagine we've given you all of this information. You have new medications, treatments, and follow-ups. Now you're home. Who's going to help you navigate that system? So we always want to make sure that patients are discharged safely, meaning that there's a plan of care at home. You have your resources. If you're newly diabetic, that you have your insulin, your machine to check your blood sugar, that your family is there, that you have a caregiver, or perhaps you're not ready to go home because you live on the 5th floor and you're not strong enough to walk 5 flights. So we make sure that we've looked at every single thing to make sure before you go home you have all those resources in place, because if you get home and don't have those, you're going to end up back in the hospital, and that's what we don't want. Pleasure meeting you, but we don't want to meet you in the hospital.
So another big issue for nurses is that their observations and opinions about patient care aren't always heard. That must be frustrating. What are some examples of that, and why is that the case?
That's very frustrating. And unfortunately, in the healthcare system, again, it's very complex. A lot of decisions are made, a lot of financial impact. So sometimes the policies and procedures and the systems that are set in place, the equipment that's purchased, doesn't have the input from the person who's actually providing the care or going to use the equipment. And as a result of that, sometimes new equipment is introduced that's not conducive to our workflow, and we're spending so much time with these machines that it takes us away from our patients. And we really need to spend time with our patients because that's who we care about. We're trying to help them and help them heal. But if we're tied up with, confusing machines and systems, it really takes us away. And so we want to be with the patient.
We've probably heard, many folks have heard about the strikes that nurses go on for better pay and better benefits for yourselves. But you say one of the things that you protest on a daily basis is the patients having access to adequate health care and health insurance. Yes,
that's a very frustrating point for us. We know that we can see patients and know that they need certain care, certain medications, but sometimes they don't have the access to health care. They don't have insurance that covers what they need. That can be very frustrating because I've seen this. I work in the emergency room. So I'll see people that are coming pretty much on their last leg when they had a little bit of a fever and a cough and they just needed to see a provider, maybe get some antibiotics, but they don't have insurance, so they can't get these services. And by the time they come and see me, there's already full-blown pneumonia. They become septic. This leads to multi-organ system failure, and they end up in the ICU. So it's really frustrating for us. And we as nurses, we work very closely with case managers, social workers, and other people in the healthcare field to try to get these services, programs, access to free clinics. So we're working relentlessly to try to get patients those services.
Thanks so much for being here this morning, Alice Benjamin, emergency room RN and clinical nurse specialist. You can follow her on social media. You can check out her website, asknursealice.com. Thank you for what you do.
Thank you. Thank you to you guys. We love the nursing profession. Thanks to you. You guys, no, really, because you guys have given us me a platform as nurses. You don't see us on television, so thank you to KTLA.